The how and the why of the What Matters Index, or WMI. More than 3 decades ago, community-based primary care clinicians began to systematically rectify the significant mismatch they had observed between what matters to patients and what clinicians knew. Gradually, they developed a simple and internationally adopted approach that placed them and their patients on the same page. Recently, the approach has been further refined and tested. The result is the What Matters Index, or WMI. The What Matters Index is based on these 5 questions. During the past 4 weeks, how much have you been bothered by emotional problems such as anxious, depressed, irritable, or sad? During the past 4 weeks, how much bodily pain have you generally had? How many prescription medicines are you taking more than 3 days a week? Do you think any of your pills are making you sick? And how confident are you that you can control and manage most of your health problems? The responses in yellow are of concern, and each item with a yellow response is summed to produce a WMI range from 0 to 5. The WMI is important for 3 reasons. First, it is right size for patients and clinicians. Its 5 items impose a very low response burden. The questions and responses are unambiguous, and therefore it fosters little interpretive variation. Second, it automatically leads to information and standard action plans based on each response, and its sum from a low of 0 yellow responses to a maximum of 5 forecast costly care as well as computerized risk models. Third, it is based on scientific studies, both that show its use improves care and that it is more strongly associated with patients' quality of life than their diagnoses. Available online with the Foundation evidence-based howsyourhealth.org comprehensive health assessment, the WMI is now being integrated into practices. In other words, the how and the why of the WMI. For example, a practice in Vermont, White River Family Practice, is a 5-physician practice with more than 7,000 patients. Jill Blumberg, when available, will describe her experience and her practice experience of the how and the why of the WMI in the year of the pandemic, 2020. Despite the fact White River Family Practice was under a lot of pressure and dealing with a lot of uncertainty during the pandemic, they decided they could do at least a test of 2 paper-based methods of the WMI. Their staff routinely contacted newly discharged patients from either an emergency department or hospital by telephone. They also asked scheduled patients with chronic diseases to complete a version of the WMI in the waiting or examination room. Generous support for these tests was provided by Blue Cross and Blue Shield of Vermont. The table describes the characteristics of the recently discharged or pre-scheduled patient population. The participating patients were generally female and older, and fewer than 20% were below the age of 50. The average number of subsequent emergency room or hospital visits during the next 4 months was much higher for recently discharged patients. For all patients, these subsequent costly encounters were very strongly associated with the patient's WMI, ranging from 1 to 30 for WMI sums from 0 to 3 or more. The figure re-illustrates that the increase in costly utilization associated with an increased WMI for all patients was highly statistically significant for both the pre-scheduled outpatients and the patients recently discharged from the hospital. Similar to prior validations, a WMI sum of 2 or higher seemed to be the optimum cut point, although some might argue that it ought to be lowered even further for patients who were recently discharged. White River Junction observed that phone administration would go very well, averaging about 5 minutes with very small variation. Patients who completed the survey themselves, of course, used their own time, although the practice staff did give a brief, less than 2-minute introduction before the patient completed the survey. White River Junction was very proud of their capacity in doing this extra work during the COVID pandemic. They recognize after doing it that the internet automation of the WMI would have eliminated the time and expertise needed to analyze data, and it also would have provided them information tailored to the patient responses and standardized protocol for management for different levels of the WMI. But for COVID, this was pretty impressive work. Let's summarize the why and the how of the WMI. It is free, highly tested, automated, efficient, and effective for both patient and the clinician. The 5-item WMI assesses what matters to all patients and reflects their quality of life. For both patients and clinician users, the WMI is unambiguous, fosters little interpretive variation, automatically provides information and standard action plans based on each response, and when some, forecasts costly care, as well as computerized algorithms. When contrasted to typical functional or quality of life measures such as the PROMIS 10, EQ5D, VR12, SF12, several advantages need to be restated. First, the other instruments contain many items that are neither actionable nor easily interpretable. Second, the other instruments often require scoring algorithms to determine if a patient's response may be an outlier. They do not readily guide subsequent services. Although White River Family Practice has shown that the how of the paper-based WMI is certainly easy for patients and staff to test in face-to-face and phone encounters, the how of the internet automated WMI has many, many advantages for both patients and clinicians. For patients, a mere click of the link at howsyourhealth.org is all they need. They then spend a few minutes answering the WMI and specify what might make them more health confident if their health confidence ought to be improved. In this example, for a patient who is not health confident, has emotional problems, and feels that medications may be causing illness, the patient immediately receives a simple summary that can be automatically sent to the clinician, carried by hand, or carried in the mind of the patient, so that the responses will guide subsequent inquiry and next steps. In the meantime, this action form suggests resources for the patient to prepare for a more efficient and effective engagement with the clinician. A practice has two choices for implementing the automated internet WMI. The least likely to be highly effective is just to provide a link to howsyourhealth.org and ask patients to complete the WMI before a visit with the practice. In other words, next steps are very much left to the patient initiative. A better approach is to customize the WMI so that the patient can email the results directly to the practice. In that way, their information will be available for the clinician. This approach increases the opportunity patient-clinician engagement will happen for improving care and patient outcomes. Moreover, patient information is stored in a HIPAA-secure registry so that the practice can examine the needs of many patients and plan population-based interventions. Let's now briefly overview a few of the clinician setups options for patient-directed submission of the WMI. It's important to reemphasize that the How's Your Health family of tools, including the What Matters Index, were developed by clinicians for clinicians who do not necessarily have computer savvy nor want to be bothered. Therefore, the How's Your Health family of tools has very simple instructions included, automatically helping the clinicians communicate with their users, as shown here, or customize at various levels, either a simple level for the WMI alone, or a more complex level for the comprehensive How's Your Health, out of which registries such as this shown for the WMI automatically are produced. And in addition, links to community resources can be made. In sum, there are many ways that clinicians can customize these tools without having to depend on anyone outside the practice to do it, and without having to depend on computer expertise to make it happen easily and well. In summary, it's important to say that the WMI has many advantages, but it still needs to have further work done. For example, there needs to be work on measurement, asking, for example, if you're trying to compare practices, what size sample do you need? How frequently should the WMI and its related single item quality measurement be gathered? How big a magnitude of change is needed? In terms of its cost effectiveness, clearly the WMI is exceedingly inexpensive since it's free and the effort involved is very small for its use. But its effectiveness should be examined in a rigorous way. For example, if one looks at what is known already about the association between the WMI and use of costly services, it would take about 18 months of follow-up for as few as 200 patients aged 50 or older from 10 clinicians compared to comparable controls to be able to demonstrate that the WMI, when followed for its action plans, results in reduction of costly care. And as a byproduct of this testing, the participants would also identify adjustments to the automated WMI that would make it highly attractive to both patients and clinicians. That then is a summary of the why and how of the What Matters Index and possible next steps.